Good morning, everybody. I'm Donna Meltzer. I'm the CEO of the National Association of Councils on Developmental Disabilities. We are a national organization that represents the United States' 56 state and territorial councils on developmental disabilities. In the states, we do great work supporting people with IDD to live their best life in the community. As you all can imagine, this last year plus has been very challenging, very difficult for everybody, but especially for many people who live with intellectual and developmental disabilities, who have had to stay home behind closed doors, no ability to really live their best life in the community, not being able to go to work, sometimes feeling very socially isolated. And some of them have been sick. And now we're at this point of vaccine being readily available for many, but difficulties getting to that vaccine for all. Today, we're here to talk about getting vaccine to people, and NACDD, through our Get Out the Vaccine campaign, really wanted to highlight two very enterprising, engaging folks who have really gone above and beyond to help people with intellectual and developmental and other disabilities, along with some folks who are elderly, to be able to get the vaccine in their own homes. So today, we are interviewing Tarik Khan, who is a family nurse practitioner with the Family Practice and Counseling Network. He also happens to serve as the president of the Pennsylvania State Nurses Association. Tarik, we're thrilled to have you, and I, of course, want to wish you a happy National Nurses Day.
Oh my God, thank you. Thank you. And we actually negotiated to get a week, so thank you.
Well,
Thank you.
nurses deserve like more than a
Yes.
week. Right
Yes.
now, we know nurses have been really the heroes and just the stars of the show over this last very difficult year, close to a year and a quarter at this point. So we're so pleased that we could be interviewing you today on National Nurses Day. Also with us is Anna Perng. Anna's the co-founder of the Chinatown Disability Advocacy Group, and she's with the COVID-19 Health Equity Project, which she will be talking about today. So I'm so excited today to be talking to you guys, because what you two have recognized is that while many of us have been able to secure appointments somewhere in our local communities or within our state to go out and get the vaccine that we have long awaited, others just don't have that same ability. And so the two of you have been working, and I want to hear a little bit more about your story. How did you decide that you had an opportunity to break down some real barriers in your community? I should mention that you guys are both in the Philadelphia, Pennsylvania area, and you recognize that there are people, particularly those with IDD, who are at home, cannot leave their homes to go out and get the vaccine. And you have figured out a way to get the vaccine to them. So I'm not sure which of you would like to start. Doesn't matter to me, but I'd love to hear what inspired you, what helped you think about this need and put together a plan. Walk us through this a little bit, if you will.
Sure, I can lead off. You know, I've been volunteering with the Philadelphia Medical Reserve Corps since the beginning of the pandemic. When we first learned we were in a pandemic, I signed up to do testing. And I did that because, you know, who better to be on the front lines testing people who were really scared, who really needed care and compassion at a very delicate time, but a nurse. And so my friend who's a nurse was volunteering. I was like, how do you do this? And so I signed up. When the vaccines started to get rolled out, I was still volunteering with this organization, and I recognized that at the end of our shift, we actually had leftover doses, and we were calling frantically people to come in to get the doses. And Anna and I, you know, Anna being an amazing community organizer and me also being an activist, realized that, well, you could go about this two ways. You could just give it to anybody who's anybody, just an arm. Or we can take a look at a bigger issue, and that is lack of access for people with disabilities to get access to the vaccine. And so we actually started meeting. We put together a group of professionals and from different organizations. And we had a couple meetings, and we basically started to talk out and think of ways that we could go about it. And Anna could probably explain a little bit more about how she actually started to reach out and get connections to get names of individuals who were homebound. But, and we can talk a little bit more about this, but it has been infuriating to see that once again, people with disabilities, people with intellectual disabilities are once again left behind. When we talk about that we have access to this vaccine, we don't have access to this vaccine. There's certain groups have access to this vaccine and other groups are unable to get it. And there's no plan to get these individuals vaccinated. And we're here in May, already Nurses Week, and we do not have a plan in a lot of places, counties, states, to get people with disabilities access to the vaccine. So that's sort of the 60,000 foot view. Anna, anything else you want to?
Sure. I'm a disabled Asian American advocate. I'm also a parent of 2 children with multiple disabilities. So this really hits home. And for the past 6 years, I've helped educate immigrants with disabilities who have not been able to get access to health and education, right? So as Tarik mentioned, when vaccines became available, I started getting phone calls from people. How do I get it? Is it safe for my child who has a developmental disability? All of these different questions. We really found that we needed to find health providers like Tarik who were willing to meet the needs of this community. And that's when we formed this coalition to kind of match health providers with historically excluded communities. And so although we have planned really great, sensory-friendly clinics, right? Really, for this group that we're talking about, people who cannot wait for a long time in mass clinics, people who may have sensory differences and may be better served at home. That answer came in the form of Tarik, who is willing to bring the Angel vaccines to their homes. So I would say, there has been this unmet need, and Tarik has been at that forefront of showing that it can be done. Sometimes you don't need to wait for the perfect program. It just takes someone that cares. And so we're really lucky to have Tarik, kind of seize the day and inspire other health providers to do the same.
What a perfect partnership the 2 of you have set up. I just love this. We've got the self and parent advocate here and somebody who's got the access to the medical community. Walk us through a little bit of the mechanics of this. So you're working in a clinic setting, Tarik, is that right?
Yes, that's correct.
Okay, and
you
kind of recognized at some point that there's vaccine available every day that's not getting into people's arms for one reason or another. Either people aren't making appointments or they have to cancel or change their plans. And as we all know, the vaccine after a certain hour of the day is not going to be good anymore. So is it the fact that you started seeing that need and saying, wait a minute, we can connect the dots here? Anna's identifying people in the community who need the vaccine. We have unused vaccine. How do we start getting it to people and bringing it there? Tell me a little bit more about that process and how you make this happen every day.
Anna, do you want to? Or
Well, I was joking that I'm surprised Tarik hasn't blocked my phone number at this point.
Oh.
But he would send me a text and say, hey, I have 2 leftover vaccines. Who should I vaccinate, right? But we started to collect in a more systematic way, like a list of people, whether they are from disability-led organizations, whether they are from advocacy groups, health providers, because some health providers, although they had the vaccines, they really didn't have a system in place for them to deliver home vaccines. So Tarik and I, essentially are coordinating in real time, 6 days a week. How do we get these vaccines in the time that we have before they expire? And Tarik, there was a wonderful video made by the Philadelphia Inquirer shadowing Tarik on a 6-hour vaccination trip where he visits people, whether they are older adults or younger people with disabilities, developmental disabilities. and how he makes that, he travels basically all over southeastern Pennsylvania.
That's really impressive, Tarik. And I imagine you do this, that they call it the angel vaccines because nobody's paying your gas bills or, your use of transportation, whatever it is, or for your time. You've just decided on your own that this is critical. We need to get people vaccinated, and you've jumped in.
Yeah, it's sort of, honestly, it's what nurses do. I mean, on the floors, when there's an issue, nurses are used to multitasking. They're used to going outside their traditional roles to do things. During the pandemic, doing testing, doing vaccinations is not something that an NP typically would do. But I have to say that, like, this is, as you said, Donna, this is a true partnership with me and Anna. I'm on the road giving the shots, but Anna's right there with me the whole time. The hours of like planning, getting the putting people in like in certain areas so that I'm not literally driving. Because when we did this at the beginning, I mean, I was driving all over the city. Like, I know it's great. It was awesome. I think the other night, Anna, we had like 6 doses, and I was home by 10:30. After that was on a day that I came in because I was off that day. I came in at 4:30 to start giving the doses. So we was able to give 6 doses in 4 or 5 hours, and it's very streamlined. But that takes work and planning,
Sure.
And I think
you need an app. You need like one of those apps that the driving services like Uber or Lyft use to know how to schedule your visits.
Anna has taken care of all of that. I mean, it's like it is really down to it. I mean, she's got it really good. But I think it's important to know that if someone like me and Anna, who are both volunteering our time, can do it, and we've done over 200 individuals. It's well over 250 angel doses, but actually 200 individuals, because we're giving Moderna. And that's another thing. A lot of people are like, well, if we don't have J&J, we can't do this. Well, we've been doing it with Moderna, and I've been going back. And so it's done in my free time and his free time as well. And she's there with me sometimes until 1 o'clock in the morning, texting back and forth because we're still giving doses. So
wow. I just want to mention too, I mean, some of the folks who contact us, they might put, a note like, hey, I'm really worried about this aspect of the vaccine experience. My loved one really does not react well to getting needles, or, these are some of their fears or sensory challenges. And, what I really appreciate about Tarik is he doesn't hesitate. He doesn't blink. He doesn't say, oh, I'm not trained for that. He really works in a person-centered and family-centered way, which I think is really, developmental disabilities councils everywhere, we champion that, and so we bring that value. So it's not just like we're giving you a service, you should just be grateful. He really takes the time to communicate and make sure that the person getting vaccinated feels like they're making an informed decision, that they feel comfortable, and that the supports are in place to make that a positive experience.
Anna, you are speaking our language. Thank you so much for all of that. And thank you for mentioning, some people obviously are a bit scared, right? We hear some things on the news. There are a lot of people who are still feeling a bit hesitant about this vaccine. So how do you manage that? When you're in, first of all, let's just talk about the fact that you're going into people's homes, right? So you've got your own health that you're worrying about. You've got the individuals in the home and maybe other family members or caregivers who are there at the same time. Are you vaccinating everybody if you get that chance? If there's the person with the disability, but maybe a spouse, a child, or a caregiver? I think that you're vaccinating everybody, but also tell us how you are calming those fears. Are there things that we all and our broader audience who's watching this video, what things can we say that really do help alleviate some of those fears and keep people calm?
I mean, I can tell you, it really, your question really gets to a larger issue of who is being forgotten and who's being left behind. There's efforts now to get people who are hesitant to vaccine. People that are homebound, though, they're no different than anyone else, and they too have there's people that really want the shot, and there's people that are a little hesitant that need outreach. And the fact that in so many places, these individuals have been completely forgotten about. There is no plan to vaccinate these individuals. There is no plan to get them, those that are hesitant, to buy in. And to their family caregivers too, as you mentioned, they too have been left out. Whereas people who were getting paid to work at a hospital were eligible for the vaccine, family caregivers, once again, were ignored. So yes, we are vaccinating. If there's more people that we can vaccinate, we're doing it. And also just being very humble and listening. What are your concerns? Anna's been amazing on the phone. I mean, she has a great voice, and she's very person-centered, and she listens, which I think is huge, because the last thing that you want to do, especially when you're reaching a community that has a lot of barriers, unfortunately, because of the way the system is set up, you have to be humble. You have to listen. You have to hear what their concerns are and not assume that you know more than they do.
That's right. And, I think our developmental disabilities councils and these different organizations that got that new funding, right, from the CDC, in partnership with the Administration for Community Living. I mean, this really empowers our community to message to each other because, despite some best efforts, we see the ad campaigns and there's not always a person with an apparent disability. And so when we really make sure that the trusted messengers are from within our disability community, I think we're going to get more buy-in. And just the other day, Tarik FaceTimed me from someone's home because a young woman with developmental disabilities, after getting vaccinated by Tarik, said, now I want to be a messenger. And so we are thinking about ways in which she can share her vaccine story with her peers so that they can say, okay, I can relate to this person. She has the same, disability as me, or she has the same fears or concerns. And look, she took that step and now I can do it too.
That is an incredible outcome. And you're so right, Anna. When we set up our national campaign, getoutthevaccine.org, it was really about getting trusted messengers to share their stories. One of the things we hear a lot through our campaign and through our national network is that while it's important to hear the science, and it's great to hear from people like Dr. Fauci and so many others who have become national icons, right? We run to our TVs every morning to hear the latest and to know what the CDC is telling us and all of these important facts. When it comes down to it, what we really want and what we heard through a lot of surveying of our network of people with intellectual and developmental disabilities is, I want to see how other people who look like me, I want to know how they fared when they got the shot. If they're okay, I know I'm going to be okay. And that looks like me kind of thing it's both about intellectual and developmental disabilities or other disabilities, but it's also about so many other diverse parts of our cultural life, right? So, Anna, here you are very, very engaged in your community. If you want to share maybe a little about that and how your community in particular is kind of doing this intersectional pull between disability community and the Chinese, is it the Chinese community? Because you said the Chinatown Disability Advocacy Group is, yeah.
That's right. So, about 6 years ago, a federally qualified health center did approach me and say, could you start a support group for immigrants with disabilities? Because somehow they're just falling through the cracks, right? And, what we found was that, immigrants who were trying to attend workshops about disability services, if there wasn't translation, they really couldn't participate and benefit. On the flip side, if there were immigrant serving organizations hosting events at inaccessible venues, or maybe not providing accommodations, these families were also kind of stuck without any options. So, the group that I founded, although it's Chinatown Disability Advocacy Project, really has served, multiply marginalized groups. And that's kind of what gave me this idea of creating this health equity coalition to really match people, to find willing providers and amazing people like Tarik, who have that heart and share the same values about, relentlessly pursuing inclusion. And I think that that's like the mission of the Developmental Disabilities Council. And I really love the GOTV, like Get Out the Vaccine campaign, because it's something that is plain language. It's something that whether you're an immigrant with a disability, if you're a person with a disability, you can kind of grasp. And so I think, all of you know, what this journey is like, whether you are a family member, whether you are a self-advocate with a disability. And I think amplifying our experiences can really reach people across, economic backgrounds, educational backgrounds. When we universally design our vaccine activities the way that you are, more people can benefit. And, again, Tarik's point that we should kind of center the people with the most complex needs, right? With intersecting barriers, because when we design something around them, when we are communicating to them, everyone benefits.
Oh, absolutely. What perfect wording for all of that. And thank you for all of that work that you are doing, which is not just supporting people with IDD, but all of this intersectional building of communities and advocates, which is essential for providing, good healthcare and great opportunities across communities. So that is just phenomenal work. You guys are both angels in your own ways and certainly together. Are you planning to keep this up until we vaccinate as many people as we can?
Yeah, I mean, I don't want to commit you. I mean, but I'm sure you're, because you're as relentless as I am. We're still getting requests from people that are homebound that can't get out, that have no other way to access this vaccine. And it is something that would keep me up at night if I said, they'll figure it out. Because that unfortunately has been the attitude of many governments, that they're going to figure it out. This is going to work out. And that's not a plan. That's you can't hope that everything is going to be great. It's not. So I'm committed to continue to volunteer as long as Anna is committed, because I can't do this alone without Anna's with me every step of the way. So
Good Morning America tried to give Tarik a spa vacation, and he said he would only redeem it after everyone who is in their homes who needs a vaccine can get one. That's how serious he is.
Wow. Well, yeah. I hope you will go for that little spa vacation when this is all said and done. Go somewhere lovely. I'm wondering if either of you has a favorite story. You've been in over 250 homes seeing people. I'm sure you get some amazing reactions and some things that probably you just can't get out of your head. Any stories you want to share for our viewers?
And I can give the one. I hope it's not the one you're thinking. So there was an individual who had been out of their day program for over a year. It was an adult with intellectual disabilities, and they were also unable to get vaccinated. They couldn't wear a mask, and because they couldn't wear a mask, they couldn't go to their day program. They also couldn't go to a vaccine center because they could not tolerate wearing a mask. So Anna was able to identify this individual. I went to their house. It was the last call of the night. It was about 9:30 at night. And I asked the mom, what does this mean to you? Her daughter's nonverbal. And I said, what does this mean to you? And she said that this means that my daughter can go to her day program. And it wouldn't have happened unless we were able to get this individual vaccinated. And so to think that this is really a game changer, this small thing that it took me, 20 minutes in the house to do. And they were incredibly grateful. And I'll say one other thing too, the fact that, we have been getting publicity about it. Actually, she said that she saw it and the day before and said, I wish I could get that for my daughter. I wish he would come here. And she said, don't you know, the next day I got a phone call from Anna saying that we have a shot for your daughter.
And, you know, I mean, that's one of my favorite stories, but I'm going to say there's one of the first folks that we did vaccinate. You know, the referral came through Special Olympics, Pennsylvania. And this was a 62-year-old father who was not yet eligible based on the phase that the state was in to get vaccinated. And he had a 40-something-year-old daughter with developmental disabilities who was also not yet prioritized by our state. He said that he had gone to 4 different area pharmacies begging them, could you just let me register in person? Could we be on a wait list? So if you have a dose that's going to get, you know, tossed out, couldn't you just call us back? And they said, no, you know, you have to register online. And he's, you know, in his 60s, not very familiar with computers. So he would wait at midnight for the appointments to get released to try to get an appointment. So when I was able to call them and say, you know, I have a nurse who's willing to drive an hour out from our city to vaccinate you and your daughter. I mean, he kind of broke down in tears because he had said, you know, the past year has been such an ordeal, you know, and to finally have someone who's willing to be flexible and to kind of meet our needs as opposed to saying you have to come to us was just a game changer. And so he had said, you know, now that he and his daughter can be vaccinated, she can return to work. And I think there's a perception that people with disabilities don't have anything to do. Like there's no jobs, there's no community to go back to. But he said, you know, now she can go back and be around friends who also have intellectual and developmental disabilities as well. You know, if they can all get safely vaccinated, that means they can play on their Special Olympics sports, you know? And so I think this is a great opportunity to highlight that, you know, people with disabilities, their caregivers, they have lives to get back to. And, you know, let's think more, like let's prioritize, you know, that community and make sure that when we're talking about opening up things, you know, going back to normal, that we really find opportunities to weave and strengthen those community supports so everyone can really experience inclusion, including, you know, people who may not able to be physically, you know, able to leave their homes. How do we bring programs to that? So that's a whole other conversation, but I know the arts and culture world is thinking about like telephonic programs and other opportunities to bring these experiences to people where they are.
Right. No, you're absolutely right. Equal value, every life needs to be valued, whether you're going to a professional job, you're out of the house, you're working in the house, you're going to a day program, you're doing whatever it is that fulfills your life and your dreams. So you two are making that happen, and that is just so incredible. I want to be very respectful of your time. So very last question, just what else would you advise others, as we started off at the top of this conversation saying the government has finally, you know, been able to secure some funding for developmental disabilities programs across the nation to get out more in communities, get vaccine to people, and get people to vaccine. What advice do you have for others that you would like to share?
I mean, I think this is a time that organizations, decision makers, policymakers, lawmakers have to step up and say, we have to make sure if we are serious about getting herd immunity, we have to reach everybody and we have to go to the people. I had not heard that before. GOTV, get out the vaccine, which is, I love that.
Yeah, we kind of played off of, you know, get out the vote, right? Now
it's wonderful. And that's exactly how it should be, because you know, it shouldn't be the only time that you're going to someone's house is when you're asking for their vote. It should be actually be once you've gotten their vote to actually, how can I now serve you? And I'm going to go to your house, because unfortunately, as we see, a lot of people are unable to leave their house, especially during the pandemic. So I think really the next step is for counties and local governments and states, and even healthcare organizations. I'm working with one now, now to do this, to go door to door in communities and start those conversations, because you're not going to have trust if you just do it once. You have to start these now and start building those relationships with constituents to see if we can identify these individuals and then have a program to a systemic way for these individuals to sign up for a homebound vaccine?
Thank you. I mean, I think that's like, you know, the door-to-door canvassing. It's like, if you're already investing in an infrastructure to do outreach, build disability inclusion and outreach into what you're doing, right? So our Philly Count census operation will be doing 6-week canvasses, but, you know, we're asking, couldn't you ask as a part of your questionnaire, do you need a home vaccination? You're already doing it. It's okay to put a checkbox, and that would go a long way. The other thing I would mention is, you know, the disability community has a saying, nothing about us without us. And so I think this funding going to disability serving organizations that are trusted networks and providers, you know, is a huge game changer, because now it says we're a part of vaccine outreach and delivery. So I would really say, you know, for those groups that have been told, like, this isn't your lane, you're not a public health group, or you're not a health professional, to really kind of elbow their way in and, you know, use this opportunity to be a part of the conversation. And I think it's also important for disability-led groups to be a part of that, because too often, sometimes the recommendations are what non-disabled people think disabled people want. So I think the more we can center those impacted and make sure that if it's a disability space, that it's also racially diverse, that there, you know, that there's all types of representation, it would, you know, go a long way to making sure our vaccine efforts reflect the diversity of America.
Beautifully said. Thank you both for everything that you're doing. Happy Nurses Day, Nurses Week, Nurses Month, maybe full year, whatever it is. Thank you for your advocacy. Thank you for addressing cultural needs and all kinds of barriers that have really just done such a disservice to people with intellectual and developmental disabilities this year. Thank you for breaking through those barriers. All I can say is, please keep up your own energy, take care of yourselves so you can keep helping others. Thank you for all that you are doing. And thank you for giving us this time today to speak with you and learn about your project and your work. I hope it will inspire many others to hop on board and either do what you're doing or something similar that works in their communities. So thank you again for your time today. We appreciate you both so very much. Take care.
Thank you, Donna. Thank you, Anna.
Thank you.